One of my viewers, Amber Morrow, recently wrote, "Hi Aaron, have you done a video on Plegridy? If not, I'd like to hear what you have to say about it and how effective, ineffective you found it to be, and the pros and cons. Thanks." Well, Amber, here comes your answer, starting right now. Howdy. Thanks for learning about MS with me, Aaron Boster. I started this YouTube channel to help my own MS clinic patients learn between visits, and it's my hope that through these videos, I can help you learn too. Today's topic, my opinions about Plegridy to treat multiple sclerosis. Now, before we begin, here's a disclaimer. I'm sharing my own personal opinions. My opinions don't make me right, they just make me really opinionated. Your MS provider has to work with you to come up with the right MS medication for you. And this video is really to share my opinions, to answer Amber's question, and to give you food for thought. So please keep that in mind as I share my thoughts. Plegridy, what is it? Plegridy is a disease-modifying therapy for multiple sclerosis, specifically for relapsing forms of multiple sclerosis. It's an interferon class medicine, interferon beta, which we believe works to tighten up the blood-brain barrier. So it's in the same class of drugs as high-dose interferons such as Rebif and beta-seron, and low-dose interferons like Avonex. And when trying to roughly compare them, I think Plegridy is probably closest to Avonex. What makes Plegridy maybe interesting as compared to the other interferons is the way that it's given. Avonex is an intramuscular injection, which is a pretty big needle inside the muscle done once a week. So every single week, people with MS on Avonex have to harpoon themselves in the muscle. The way that Plegridy is formulated, it's given subcutaneously, meaning it's given just under the skin, so it's a much smaller needle. And it's given half as often. It's only taken every 2 weeks. So you can imagine when considering low-dose interferons, Avonex versus Plegridy, Plegridy has an upside because you give it less often and you inject less deep. So, what are my personal opinions about Plegridy? When considering the 17 different flavors of FDA-approved MS medicines, it is by far one of the least effective. I'm talking about ability to decrease relapses, delay disability, work on brain volume, these kind of things. It doesn't do it as well as the other drugs. Now, given that I typically consider my drugs first based on efficacy, you can imagine that this drug would be placed way down at the bottom of that list. Second of all, the class of interferons are not something that I really embrace. When I consider the cost of the drug, the efficacy you get from it, and the safety and specifically the tolerability, when I consider all those variables, this is not a drug that I want to subject my patients to. It's my opinion that for about the same level of cost, I can have a much more efficacious class of drug treat my patient, and arguably with better tolerability. Again, that's just my opinion. Now, with all that being said, I have prescribed Plegridy to some patients. And you might say, well, wait a second, Aaron, well, you just finished saying how you might rank it much lower based on efficacy. Why would you do that? Well, the specific situations have been people with MS who are super stable on their interferon, but they don't like the way they have to take it. Either the injections are hurting or they're too frequent, and as such, they wanted to make a lateral switch where they went from one interferon to another interferon, probably didn't alter the efficacy very much, but gained something in tolerability. And so there's been a small handful of patients that wanted to do that, and I did that with them. And so there you have it, Amber. My personal opinions about Plegridy and its role in treating MS in 2018. Again, I want to remind you that this is my own personal opinion, and it doesn't make me right, it just makes me opinionated, and that you have to talk to your own MS provider about which is the right MS medicine for you. And the question of the day, what do you think? Where do you think that Plegridy fits into the MS armamentarium, the available drugs to treat this condition? Where does it fit in your mind? Also, if you've received Plegridy, what's been your experience? Please share with us. Once again, my name's Aaron Boster, and thank you for learning about MS with me. If you'd like to see more content like this, please take a moment and subscribe to the channel. And you can do that by hitting the little red button. And until my next video, take care.